Chronic obstructive pulmonary disease. What is COPD? COPD is a group of progressive lung disease. The most common are emphysema and chronic bronchitis. Many people with COPD have both of these conditions. Emphysema slowly destroys air sacs in your lungs, which interferes with outward airflow. Bronchitis causes inflammation and narrowing of bronchial tubes, which allows mucus to build up. COPD makes it harder to breathe. Symptoms may be mild at first, beginning with coughing and shortness of breath. As it progresses, it can become increasingly difficult to breathe. You may experience wheezing and tightness in the chest. Some people with COPD have exacerbation or flare-ups of severe symptoms. How does COPD affect the lung? Damage to the lung tissue over time causes physical change in the lung, and the airways become clogged with thick mucus. Compliance becomes weakened because of this lung tissue damage, and this leads to poor oxygen and carbon dioxide exchange in the lung. This all leads to coughing to remove the thick mucus, eventually difficulty in breathing. The symptoms of COPD, such that shortness of breath, wheezing, chest tightness, chronic cough, and overproduction of sputum. There are causes and triggers of COPD. First, smoking and secondhand smoker. Second, genetically test through family members. Third, stronger odor, chemical fumes, pet dander, and also environmental irritant such as pollution, extreme in temperature, and pollen. There are three pathophysiology of chronic obstructive pulmonary disease (COPD), such as airflow limitation, hyperinflation, and dyspnea. Airflow limitation. The airflow limitation that defines chronic obstructive pulmonary disease is the result of prolonged time constant for lung emptying caused by resistance of the small conducting airways and increased compliance of the lung as a result of emphysemaceous destruction. The lesions are associated with a chronic innate and adaptive inflammatory immune response of a host to a lifetime exposure of inhaled toxic gas and particles. Processes contributing to obstruction in the small conducting airways include disruption of the epithelial barriers, interferes with mucociliary clearance apparatus that result in accumulation of inflammatory mucus exudate in the small airway lumen, infiltration of the airway walls by inflammatory cells, and deposition of connective tissue in the airway wall. This remodeling and repair thickens the airway walls, reduce lumen caliber, and restrict the normal increase in caliber produced by lung inflation. Hyperinflation. It can be caused by obstruction in the passage that deliver air to your lung tissue. Air gets trapped within the lung and causes overinflate. It occurs when the air sacs become less elastic, which interferes with expulsion of air. Then, dyspnea, caused by airflow obstruction, airway inflammation, airway remodeling, and sputum secretion. There are four types of pharmacological treatment of COPD. First, bronchodilators, mucolytic drugs, expectorants, and antibiotics. Bronchodilators. If you have COPD, your main symptom is probably shortness of breath. You might get short of breath when you exercise, when you do chores, when you feel upset, or for no reason at all. Bronchodilators medicine opens up the airways in your lungs. When your airways are more open, it will be easier for you to breathe. Doctors may prescribe more than one kind of bronchodilator to treat COPD. There are two main types of bronchodilator. The first, beta-2 agonist, and anticholinergic. Example for beta-2 agonist is salbutamol, terbutaline, salmeterol, and indacterol. And for anticholinergics is ipratropium bromide, tiotropium, glycopyrronium, and aclidinum. Mucolytic drugs. These drugs break down mucus to make it easier to clear the lung and airways. There are three types of drug: N-acetylcysteine, antimuscarinic drug, and bromhexine. This drug reduces mucus secretion in airways by antagonizing acetylcholine receptor in mucus gland, and also it reduces the bronchospasm associated with smoking and inhalation or irritants. Expectorants. This medicine increases fluid in lungs and airways, and it also would help secretion to liquefy and thin. There are three examples of expectorants: guaifenesin, potassium iodide, and ammonium salt. Antibiotics. COPD flare-ups can be caused by viral infections, for example the flu, or bacterial infection, for example bacterial pneumonia. If you have a bacterial infection, you can treat it with antibiotics. If you have a viral infection, antibiotics won't work. It's important to take your antibiotics as directed by your doctor and to take all of the antibiotics. When people don't take all of their antibiotics, infections can become stronger and harder to treat. There are many non-pharmacological treatments of COPD, but I've stated three. First, pulmonary rehabilitation. Second, supplemental oxygen. And third, telemedicine. Pulmonary rehabilitation. It aims to counteract the loss of skeletal muscle, to improve exercise tolerance and exertional dyspnea, and it also includes exercise training, nutritional supplementation, and psychosocial support with supervision of physiatrists in a special clinic. Telemedicine. It allows patients with COPD to connect electronically with a specialized care consultation. It also can be used by physicians to collect information from the patient and track his or her progress on a daily basis. It also used to alert the medical team to the early onset of acute exacerbation of COPD. It also avoiding emergency department visit and administration. Supplemental oxygen. Severe COPD, it may be hard to get enough oxygen from the natural air. It caused by shortness of breath. Oxygen therapy can help people with very low blood oxygen levels and also called hypoxemia. It also helps in temporary lung damage from infection, for example pneumonia. Oxygen can only help people who have very low blood oxygen levels.